Good evening. Welcome back to Let's Talk with Tammy, brought to you by BKNI Resources. BKNI Resources is a comprehensive consulting company in working with individuals, businesses, schools, the government, and organizations. And they have 10-year-long track record in conducting seminars, workshops, and individual series on personal branding. For those of you who are tuning in for the first time, this show features personalities from all walks of life, sharing profound insights into relevant topics. I'm Tammy, your host, and my basis for the show has always been about sharing my personal journey to learn anything that piques my curiosity. So for this evening's episode, we're going to be discussing about advanced maternal age pregnancy, and I'm absolutely delighted to have Dr. Mathi Arasu on the show with us. Good evening, Doctor. Thank you for being here this evening.
Hi, thank you for having me, Tammy.
Okay, so a little bit about Dr. Arasu. He's one of the few registered fertility specialists in the National Specialist Register, and he's been actively involved in the field of reproductive medicine for more than 15 years. And he's also had the opportunity to work with renowned fertility specialists who led Oxford Fertility Unit in the University of Oxford. And upon returning to Malaysia, he took on the role as a medical director for Fertility Associates Malaysia, a sister company of Fertility Associates New Zealand. And recently in 2019, Everlink Fertility Centre, a giant player in international fertility scene, offered a collaboration to build a world-class boutique-style clinic in Malaysia, in which he is now the medical director. So before we start, I'd like to remind our viewers that this episode is currently live on Facebook and YouTube. And if you have any questions at all, feel free to drop them in the comments section, and I'll be sure to share them on screen for our doctor to answer those questions. So, doctor, so can we just start with what it means by advanced maternal age?
I mean, it's a very good introduction for the topic as advanced maternal pregnancy at advanced maternal age. But for us to define what advanced maternal age means is quite difficult because there's no one definition of advanced maternal age. Therefore, arbitrarily, it's chosen as 35. And sometimes when you read literature, it might say 38.
Right.
Because different group of people take advanced maternal age as different age group, but basically it's between 35 to 38. Because reproductive age for women is between 15 to 45 roughly. So 15 to 25 is a different set of group. 25 to 35 is the ideal age, so-called ideal age, when women normally start building families and started pregnancy. 35 to 45 is the studies and would define advanced maternal age for pregnancy would be 35 years and above for women.
Okay, more than 35 years old. Right.
And,
so,
just to add on a little bit, it's also quite sensitive to call someone advanced maternal age because some women might feel offended. I'm just 36. Why am I be categorized? But this is for categorical reasons, but not just for simple reasons. Yeah.
Right, and I think for the longest time, a more offensive term was being used, which is geriatric pregnancy. And when you hear geriatric, it's like,
yes, exactly. It's not a nice term, and definitely should not be used in women who are contemplating to get pregnant or in their pregnancy.
Right. Okay. So you've told earlier about how advanced maternal age is only to categorize because you have a different set of fertility rates, and in terms of biological reproductive system health also changes between different age groups. So how does age affect actually fertility and pregnancy?
See, women's age is the most important and most strongest predictor of a success of a pregnancy.
Right.
And in any whether we're talking about natural pregnancy or you're talking about treatment,
right,
fertility drops as women grow older. Why? It's because eggs in women, which we call oocytes or eggs, that is in the ovary, gets lower in terms of numbers and also gets poorer in terms of quality as women grow older. The moment they reach menopause, around the age of 50, 51, they've exhausted all their eggs, and that's the time they can't be using their own eggs for pregnancy. So that's why age is the most important factor for pregnancy, whether natural or through treatment. And that's why
Right.
we always talk about age and women in their terms of pregnancy.
Okay. So, is there a reason I have to ask this question? Because is there a reason why most of the time when we talk about pregnancy and aging, we only talk about the mother? But does fertility rate decreases for men as well? I mean, I know it's not. I mean, what do you think?
I mean, scientifically, women are more affected with age compared to
Right.
men.
Okay.
For simple reason, the moment they
Mm-hmm.
grow older, the pregnancy rates becomes lower,
Mm.
and there will be a window of opportunity for them to get pregnant. The moment they reach menopause, the window closes.
Right.
Unlike men, men continuously produce sperms. Of
Right.
course, their fertility do drop, but they can still father a child because they're still producing sperm.
Mm.
The question would be, do men's fertility drops as they age? Yes, they do drop, but are they
Okay.
significantly going to affect their chances of being a father? Not really. But for
Okay.
women, yes.
All right. Okay. So that was in terms of trying to conceive, in terms of conception. So what
That's
about the labor itself or the health of the baby?
pregnancy affects women who are above the age of 35 and or women who are older when they
Mm-hmm.
conceive. Older women tends to have higher risk of abnormalities in the fetus. For example, Down syndrome risks are higher as women grow older. That
Mm-hmm.
is why we see a lot of risk of miscarriages happening in older women as compared to
Right.
younger women because
Right.
risk of abnormalities in the baby.
Mm-hmm.
Two, women who are older tends to have higher abnormality in labor. For example, they tend to have prolonged labor, they tend to have obstructed labor. The abnormalities in labor itself carries a risk of baby being affected. And
Right.
that is why older women tends to go for cesarean section as compared to
Mm.
trying for normal labor.
Okay.
And more worry for women who are older is the tendency for them to get diabetes during pregnancy, medical
Mm.
disorders. Older
Right.
women tend to have higher risk of diabetes during pregnancy, hypertension during pregnancy, thyroid dysfunction, and also all this may affect the fetus as well as the
Mm-hmm.
mother during pregnancy and also during labor. That is
Right.
why the whole pregnancy in advance.
I think there's been
Oh,
a bit of lag, and
yeah.
yeah, you froze a little bit there, but I
Uh,
think we stopped somewhere around all this. How does you were saying all this, you have the gestational diabetes, hypertension, hypothyroidism, and all those things, and I think we missed the part how these will affect the baby.
so early pregnancy, all these medical disorders may affect the mother.
Mm-hmm.
Also, they may affect the fetus. That's why the risk to the mother and the fetus, we're not talking about one person here, we're talking about the fetus as well as the mother
Correct. Mm-hmm.
increases. And that is
Yep.
why they are categorized as high risk pregnancy. Why?
Mm.
Because the fetus is also have a risk of getting some abnormalities due to mother's problem, and mothers also
Correct.
have higher risk of morbidity. We call them morbidity because they tend to have
Mm-hmm.
higher risk of going into heart problems, diabetes worsening their kidneys, and also labor itself. They may tend to have abnormal labor and high risk of cesarean section.
Okay. So I just want to get this clear again. So basically, it doesn't matter that the mother might have been healthy. I mean, she might have been 38 and healthy, but then she would develop these issues as she get pregnant. Is it meaning she would get diabetes? Is that what you're saying?
That's true. That's true.
Okay.
Women who
Right.
don't have medical disorders before pregnancy may develop all these medical disorders due to pregnancy.
Right. Okay. Okay. Right. And so, based on your practice so far, what would be because it is a fertility clinic, and so since we're talking about how the chances of trying to conceive also decreases as women age. So, are they of due to because they are of advanced maternal age? Are they? Is that the reason?
I mean, in my practice, I can't be speaking on other person's clinical practice because we may see a different group of people. In my
Right.
practice, where I see mostly couples coming in to try
Mm-hmm.
to get their first pregnancy, not because they are pregnant. Most of them come to see us because fertility population. My personal practice, I have about 40% patients above the age of 40. So if
Right.
you're talking about advanced maternal age, then I have to bring down the age to 35, then it'll become about 67, 70%. So two-thirds of
Right.
my patients may fall in that category of advanced maternal age.
Mm-hmm.
But why they come and see us is a wide spectrum. For
Okay.
example, I could easily say one-third or two-thirds of them definitely have some gynecological issue.
Okay.
These women already have some form of pelvic disorders, such as gynecological disorders like endometriosis, fibroid,
Mm.
blocked tube. But another one-third of them actually have been trying for a long time
Right.
and didn't fall pregnant despite not having any medical problem. But age alone is a bigger factor. For example,
Mm.
41, 42 just got married or trying for a baby within the last 6 months or 1 year. The age itself is a biggest factor.
Right.
So
Okay.
we see this very often now. Those days we used to say it's a Western population where we see older women coming to the clinic.
Yeah.
10, 15 years ago, women who come to see our clinic, they don't come alone. There are also single women who empower themselves to come in earlier before they have a partner.
Mm-hmm.
And therefore, we're seeing more of women who are coming at a later part of their reproductive age.
Right. Okay. And when you see all of these people, like, so when you say there are 40, 41-year-old women who are coming in, and they're coming in for their very first pregnancies, right?
That's true.
Okay. And based on what I've been reading, a lot of the times the reason why there's a like what you said, women are more empowered. They are getting educated first before, thinking about starting a family. They want to achieve something in their career first before starting a family. And there's also this new social concept of like, I'm not ready yet. I don't think 30 years ago anyone would have given that as an excuse of not wanting to have a baby. But now they think a lot about, am I ready to become a mother? Am I ready to become parents? So based on your consultation with your patients, what are some of the reasons that, the reasons for their delayed pregnancies?
Typically, looking at those women who with no medical problems, who
Mm-hmm.
sees us, the first few things that I notice, they always think I'm a healthy 40-year-old, therefore I'm fertile. That's a totally wrong
Okay.
concept. Health
Right.
is a different entity altogether. You might be a very healthy person, but not necessarily a fertile person. On
Okay.
the other side, you could have lots of problems. You could be diabetic, hypertensive, overweight, smoking, but you may have a
Mm-hmm.
few kids. Fertility never been an issue. Therefore, being healthy and being fertile are two different entities. But of course, if you in order to get a better fertility, you should be a healthy person. It doesn't mean just
Right.
because someone else is unhealthy and getting pregnant, you should not be following their footsteps. But that's
Right.
one of the myth I would say a lot of people have. I'm healthy, therefore I'm fertile. Two, they always think someone else could have get pregnant. Therefore, I
Mm.
also should keep on trying. You can't go on trying for pregnancies, your fingers crossed. It doesn't work that way. All
Right.
women have a window of opportunity
Mm-hmm.
very early. There's a narrow window of fertility. For example, there's 1% of population women go into premature menopause, meaning
Okay.
1% of women population, the general population,
Mm-hmm.
may go into menopause before the age of 40.
Right.
Therefore, their opportunity of having a baby is closed. So,
Mm.
even before they reach 40, therefore, they should understand that if I were to get a pregnancy, just like getting my health screen, why can't you get a fertility screening way before you even thinking of starting a family? So these are
Correct.
the two common things. Keep trying,
Mm-hmm.
keep thinking they are healthy. And the
Mm-hmm.
third is the public social media. Sometimes they compare themselves with the older women who got pregnant, artists, celebrities. They wouldn't know what kind of pathway they took. They might have gone
Yeah.
through donor eggs or donor embryos, something different, but they don't share with you. So that also
Right.
sometimes gives you a wrong impression.
Mm.
Older women can get pregnancy easily.
Okay. So what you're trying to say is they come in pretty confident that they can conceive, and then they get very heartbroken knowing that, okay, there's so many other issues that I had to look at despite me being healthy.
That's very true. Yeah.
Okay. Okay. So before I move on to the next question, because I see quite a number of viewers are there already, so I just would like to remind for those of you who are watching, if you have any questions at all, you can feel free to type them in the comments section, and I'll be sure to share those questions on screen. So in terms of trying to get pregnant, and as you said earlier, it's going to get harder as you get older, right? And when would be the time, or how would we finally decide, okay, uh, the natural way is not going to work? Like, how would
Right.
we know that?
So if it's speaking scientifically, it's
Mm.
always been said that if a woman is 35 years old, we're not talking about the male partner.
All
If a
right.
woman is 35 years old or less, a 1 year of trying is good enough to say enough of trying, something is
Oh,
wrong. Because
okay.
80 to 90% of population, if they have no problem, they should fall on the first year of pregnancy. They should fall pregnant within the first year of trying. So
Okay.
the 10 to 15% of population is not good enough. So the recommendation is if you've been trying for a year, get yourself screened for fertility issues. Whereas women
Mm-hmm.
who are older than 35 years old, where that's where the advanced maternal age comes in, six
Mm-hmm.
months of trying is good enough. Don't wait longer because your window is
Okay.
getting narrower. So we do not
Right.
want to wait longer because age
Okay.
itself is already a risk there.
Mm. Okay. So if we have decided, okay, so natural way is not going to work, what are the common procedures available for us, especially in Malaysia?
I mean, if you're talking about fertility treatment, I would normally, for the first time, if I'm seeing a couple, I'd never go into the treatment because I would say treatment is for someone with a established problem. I
Mm.
would say let's get them screened and
Okay.
never miss a male partner because 50% of problem lies with the man.
Right.
Now, it's a very different way of looking at fertility problem because those days you don't see men coming to fertility clinic, but in my practice I've seen that change remarkable changes where men comes earlier than their wives sometimes.
Okay.
They come and do it first. So first of all, always never assume they have a problem. Always get them screened because sometimes it's just a
Mm.
simple timing issue or some different kind of problem that doesn't require treatment. So we normally get
Right.
them what we call a fertility screening for female and a male done at single visit. So the first time you
Mm-hmm.
see them, probably 90% of the time you already would know what could be the issue.
Okay.
So get a screening done first, and then
Mm-hmm.
only we delve into the treatment if need to.
Okay. And the possible, so if let's say, for example, if we're talking about assisted reproductive technologies, right?
Yeah.
So what are the kind that are available here?
When we're talking about assisted reproductive technology, it specifically means we are doing IVF.
Okay.
So there are fertility treatment available
Mm-hmm.
without doing an ART assisted. You could just
Okay.
assist them easily. So it's a very wide spectrum,
Mm.
but in a very simple way is sometimes you can just give them medication. Egg stimulation for women. You give them some tablets and see how they respond in terms of growing the eggs, tracking them, and to tell them probably timing is an issue. Let's get the timing for intercourse correct so that we may have chance to fall pregnant naturally.
Okay.
Having
Okay.
failed that,
Mm.
probably we move on to something simple like what we call an intrauterine insemination, meaning
Mm.
we process the husband's sperm or the partner's sperm and we just inseminate into the uterus as if we are doing a simple procedure like a pap smear.
Right.
So we coincide the timing of ovulation and putting the sperm, so increases the chances of the eggs and the sperm meeting.
Okay.
And having no luck with that, probably we may move on to ART, assisted
Mm.
reproductive technology, in the form of IVF. So
Okay.
IVF is probably the last of the highest possible chance of falling pregnant, the best possible chance. But
Mm-hmm.
before that, there are other pathways that we could take if there are good reasons to do so.
Okay. Right. So speaking about IVF, because I was reading your profile and it said, you're working towards making IVF accessible to lower socioeconomic groups. And I
Yes.
think a couple of months back, I was also listening on BFM, like they were saying how Malaysia is heading towards an aging population and the birth rate is declining. And they should include IVF as part of some sort of an insurance plan so that, people could afford it because I think IVF is expensive, right? So could you share what are the things that you are planning to do to make IVF to be more accessible?
Unfortunately, I'm not in any of the bodies that could go and vouch to the government, to speak.
Mm,
And nor am I a politician, but
right.
um, I would say that if the, I mean, government does have their own IVF centers, and they are decent. They are good centers, but unfortunately, the population they are serving such a big population, so there's a lot of
Mm,
waiting time, limited resources, and badly affected with the COVID now. Therefore, a lot of these opportunities for patients are in the private sector. So
okay.
if I like to make IVF accessible for two reasons, because I think government can't cope with it,
Mm,
and a lot of to adopt all this and offer to the patient. But I don't think insurance will cover, because then we might misuse it. You see, for
Yeah,
example, a patient
definitely.
might not need IVF, but because of the insurance, we might tend to do IVF. Take away the financial costs. I think very
Mm-hmm.
important for us to focus on the emotional cost.
Mm.
It might fail in a young woman, but the take-home message for her would be very terrible, because just because she did IVF and she doesn't got fall pregnant. So we should keep IVF as a treatment rather than an option. Some patients will say, I don't have time, I want to get pregnant quicker, sooner than later. That's not IVF. IVF is for treatment. Therefore,
Right.
I strongly believe that we should try to minimize and introduce what I have in the clinic called mild IVF.
Mm-hmm.
Instead of giving a lot of injection and increasing the cost of IVF, we
Right.
minimize, still offer them an IVF, but at a lower cost, where can they still able to sustain financially and give them a
Mm-hmm.
good pregnancy rates. And that's where
Okay.
I think we should, because all these with that concept. I know a lot of my colleague might not agree with that, but I still disagree that we should push them to withdraw their own money, still their own money. The only
Right.
way we can help is through collaboration with the government entity, if we can,
Mm-hmm.
private government, where we could
Okay.
reduce the share, where
Mm.
patients still get some form of government medication, and the private should bring down the cost to help them. Or the private, with all the resources that we have, we should make it cheaper, more accessible, rather than
Right.
making the cost of higher. And one of
Okay.
the ways is to do what I would say natural cycle IVF or milder IVF, where we could bring down the cost of overall medication and
Mm.
make IVF accessible to a lot of middle income or lower socioeconomic group.
Okay. All right. So when it comes to, okay, so that is IVF, but earlier we were talking about pregnancy risks,
Right.
and a lot of women when they try to get conceived, but whenever they try to even say that, okay, you know what, I will think about family or planning for family after or later after 35, and the first thing they say is, are you sure there's going to be a lot of problems? So what are the risks we were talking about earlier? That was yes, but is there any way to alleviate those risks?
I mean, to alleviate certain risks, you can't. Some risk we
Okay.
can avoid totally. You can avoid. For good example is, those days your mom used to say, "Get married early to have a child." I think always I used to, a very clever person once told me, always listen to your mother. But I think that's very true. Starting a family at an earlier age definitely have your better chance of falling pregnant. But we have to look at the current social economic
Mm,
situation, that women are definitely starting to get pregnancy earliest, probably in their early 30s. The
right.
demographic has changed, but that is only when trying naturally. So by the time they're mid 30s or late 30s, that's the time that hits them, that I've been trying for some time, therefore I need to go for something really higher chance of falling pregnant, that is IVF. So
Right.
alleviating that, you can't reverse aging. So
Of
what we
course.
can
Mm,
do is, one option is like what in certain people like, or women who's not in a stable relationship and not sure whether their partner is going to be the father of their child. What they do, they might freeze their eggs in their early 30s,
mm,
with the only intention is, I'm not ready to have a baby now, or even I'm not ready to have a pregnancy with this partner now, but I would like to keep my options open when
right.
I reach late 30s, but time might not be on my side. Therefore, I freeze my eggs. This is what we
Mm,
call egg freezing for
mm-hmm,
women who are planning for pregnancy later for social reasons.
right.
We also do egg freezing for medical reasons. For example, women who are diagnosed with cancer, who are
Mm,
single and about to lose their ovaries because of surgery, or probably going to premature menopause because of radiotherapy or chemotherapy. Therefore,
right.
we freeze their eggs before they undergo treatment. Those are egg freezing for medical reasons. So these
Mm,
are the one or two ways of alleviating risk of not pregnancy at a later part. But there's no real way of reversing or delaying the exhaustion of eggs.
right.
Unfortunately, so unfortunately, there's no way. And the other
Okay.
way is, of course, if you're in a stable relationship, they freeze their embryos and to have a
Mm,
baby later.
okay. I mean, okay, freezing eggs I can understand, but why would anyone freeze their embryos?
For example, those who are in a stable partnership, they would like to have, say, this is the partner that would be father of my child. Therefore, they freeze their embryos, because embryos have almost 100% chance of survival. That's very
Right.
important to know because women always think if I freeze my eggs, I have frozen about 15 eggs, therefore I have 15 eggs frozen for future. But you have to understand all these eggs that are frozen, they're very, very, very easy to go into degeneration. So if I've
Right.
frozen about 10 eggs, I normally will tell them the survival rate is about 90%.
Okay.
So still not too bad. Those days it was 50 to 60%. With the advent of technology now we can have up to 90%. But embryos on the other hand, almost 100% survival.
Okay.
So therefore, women will normally freeze their eggs, and this is called egg freezing.
Okay. And when it comes to egg freezing, when it comes to embryo freezing, so these are all available in Malaysia.
I would say whatever high-end fertility treatment that is available in the West those days are typically and probably similar in terms of
Okay.
success rate because you know technology transfer now is so
Mm.
easy, and most of
Right.
this technology doesn't only come from the West. There's a lot of good technology that comes from Japan, the East, in China, Singapore, and all these technologies are actually applicable in any countries in the world. Therefore I would
Right.
say if you were to have any form of treatment in Malaysia, it's as good as having it in the West.
Mm. Okay. And speaking of risk, there's also this thing about, a lot of people say that, oh, the risk is actually not as high if it was not your first child. Is that true?
Sorry, I didn't get you, Tammy.
So, for example, like let's say I'm 35, but this is my first child, and comparing that with a mom who's actually having her fourth child now at the age of 35, and they say that the pregnancy risk and everything is considerably lower. Is that true?
I mean, those who are having the first pregnancy at a later age definitely has a lot of risk because they have no proven pregnancy track. For example, a
Mm,
woman who has delivered three child before, chances
right.
are she never developed any complication during pregnancy. Chances are she might not be developing anything because she has gone
Mm,
through three proven pregnancy with no medical problems. And therefore, we can say the fourth pregnancy might be better. However, a first pregnancy can go both direction. It could go
true.
completely
Okay.
uneventful, or even from the day first week of first trimester itself, you may have a lot of issues.
Okay. Okay. And speaking of, earlier you were mentioning about how when it comes to planning ahead, okay, you've mentioned like, freezing eggs because, okay, right now I have no plans, but, maybe in the future, 10 years down the road, I might want to have kids. I want to freeze my eggs now. That is one option. But there's this thing called reproductive life plan. A lot of people have been talking about it. And so what is it? And is this egg freezing part of that?
I think there's no one way of looking at a so-called reproductive plan because if I see a 22-year-old
Mm,
who comes in with a gynecological problems, for
okay.
example, someone who 22 years old diagnosed with an ovarian tumor, for example, for her, a reproductive age probably not so important now. The gynecological problem is important, but definitely
Right.
whatever surgery that I'm going to do will affect her future fertility.
Mm,
Therefore, I might go into that topic with her then. But if a 22-year-old come in just for a health screening with no medical problems, I wouldn't want to go into, but I would just do a screening. I would say every woman, the moment they enter into their reproductive age, in the mid reproductive age, which is 25 to 35, should have
right.
their fertility screen. Not because they are
Okay.
planning to have a baby, but at least it gives them an additional information. If I were to have a problem in fertility at the age of 30, if I were to develop diabetes at the age of 50, and I already have some abnormalities in glucose, I could alter my lifestyle now so that I can prevent
Mm,
diabetes or delay diabetes. Similarly, a woman who may have a problem in future could actually take some aggressive lifestyle changes to address that issue. A good example will be in our population is polycystic ovarian syndrome. In short, they
mm,
call it PCOS. So common, affects about probably about 30 to 40% of the population. It's
right.
so that common, but not many people are taking aggressive lifestyle changes. There's still
Mm,
a lot of overweight adolescents, overweight young adults who are not taking any aggressive manner to address that issue. So these are all
right.
poor reproductive plan, I would say.
Okay. Okay. I think since you brought up PCOS, I think we need to talk about it a little bit. So, what are the ways? So, I noticed a lot of things that people have started talking about it a lot more now, because I don't think people knew about it or are aware about it before this. So what are some of the ways to know that there must be something wrong, or that I could be having PCOS?
I think one of the gynecological common disorder is PCOS. So
Mm,
PCOS always normally starts with abnormalities in the menstruation cycle.
okay.
Women with
Okay.
irregular cycles, or even sometimes they can have a prolonged abnormal bleeding. And
Mm,
sometimes it starts as early as teenage years. And
right.
what normally the parents will do, see a gynecologist or see a doctor, take some birth control pill just to address the menstruation problem, but not
Yeah.
addressing the underlying problem, which is PCOS. And the
Correct.
child might grow up with a lot of hormonal imbalance in their body, but must buy the combined pill, the oral contraceptive pill.
Mm,
I'd give them a regular cycle, but it masks the overall underlying problem: weight, excessive hair loss, excessive facial hair. Some
mm,
women may present with a totally different presentation. They might present with abnormal bleeding. Some
okay.
will present with excessive testosterone presentation in their body, excessive hair loss, excessive acne, facial hair. This is one way of presentation. And another
Okay.
person might present with early onset of diabetes as early as teenage years or mid reproductive age group. And that's
Okay.
where they should at least have some form of screening. Why am I having this problem?
Mm,
Common things are common. PCOS is being one of the common disorder.
mhm.
Therefore, they should do a screening and address it there and then, not giving them pills and mask it. So, lifestyle modification works wonderfully in PCOS, and you don't even have to
Okay.
treat them with medication.
Right.
Because the long-term complication of PCOS is developing cardiovascular problem like heart disease, high abnormal cholesterol, more higher risk of these women developing type 2 diabetes. And what worries us is the risk of endometrial or uterine cancer is very high in this group, and it
Okay.
also affects fertility.
Okay. And when it comes to this PCOS, when you say lifestyle changes, so that would be, do we need to see a doctor for that? On what are the ways to change our lifestyle?
No, I mean, first of all, the PCOS is thyroid dysfunction, very common
Mm,
in women, about 9 times higher in compared to men. So that is
okay.
what a gynecologist, not necessarily must be a gynecologist, even a physician for that matter, could see the person, at least make a diagnosis. If the diagnosis is correct, the first line of treatment, I would say, not medication, but lifestyle modification. So, assuming the diagnosis has been done, PCOS, the lifestyle modification, I think, should be combined with some dietitian and some exercise, see some personal trainer or some physiotherapist or somebody that can help you with this motivation part of it. But definitely a
Right.
dietitian is important because diet comprises almost 30 to 40% of way of losing weight or management of
Mm,
weight, and the other
okay.
60-40% is of course diet, physical exercises.
Okay. When it comes to delayed pregnancy, right? Because I recently had someone who's pregnant at a advanced age, and then they actually offered to do additional genetic screening. So is that important, or is that just as a precautionary, you know?
I would say it's very, very important because any pregnancy may be affected genetically. Some
Right.
pregnancies, they don't even go beyond 7 or 8 weeks because they might have a severe genetic abnormality. They go into miscarriages. Women in
Mm,
their 20s have about 20% risk of miscarriage, whereas women in their
right.
30s have about 35%, whereas women in their late 30s, early 40s have almost 40 to 50% risk of miscarriage. Therefore, the
Mm,
risk of miscarriages goes up as women grow older.
right.
The recommendation would be the moment they're 35 or 38 at least, they should have a genetic assessment of the fetus.
Okay.
The moment the fetus is more than 10 weeks pregnancy, in
Mm-hmm.
natural pregnancy or someone who already pregnant, we do a blood test in them. Those days we need to wait for 3 months to do a fluid. We aspirate the fluid from the pregnancy or some tissue to diagnose that. But nowadays the technology is even better that we don't have
Right.
to do any testing on the baby, but you just do a genetic makeup of the fetus. So I would
Okay.
definitely recommend these tests for women who
Mm-hmm.
are 35 or 38 and above, definitely 38 and above,
Right.
to have this test done to at least
Mm-hmm.
get an early diagnosis that I'm not dealing with abnormal fetus. Therefore, I could just concentrate on getting the next part of it, monitoring the fetus growth, make sure I don't have any medical disorders. Because if the fetus is abnormal, then we
Right.
are going to talk about termination of pregnancy.
Mm. Okay. So that will open another can of worm, because I was just reading an article earlier about how doing that is seems to be ableist, because we shouldn't be devaluing a child with a disability. But what do you think about that?
I mean, scientifically, it's very difficult because sometimes we are dealing with emotional issues, ethical issues, as
Yeah.
well as sometimes cultural issues. But
Mm.
I would say across the board, the moment the child or the fetus is compatible with life, therefore, definitely it's the best for the parents to accept termination is the only way out.
Mm.
However, there is one or two abnormalities that are not lethal. For example, Down syndrome is not lethal, but
Right.
it's medically allowed to undergo termination because the child
Mm.
does not have a very good outcome later part in life. It's going to take a lot of emotional, long-term impact on both the child and the family. Therefore, on that ground, it's allowed for medical termination of pregnancy.
Okay.
There are very few indication that you cannot do termination for those who are very mild abnormalities that compatible with life. You can't offer termination of pregnancy.
Okay. So since we've been talking a lot about advanced maternal age and what are the effects and what are the risks. And since we are also, I mean, on the surface, we are still talking about fertility and trying to get pregnant. What are some of the problems men come to the center?
I mean, men, you'll be surprised. 50% of problems in fertility are male related.
Right.
We can read about it. You can think about it, but this is the fact.
Mm.
50% is male. I can close my eyes and one day I can just tell if 10 patients waiting to see me, I can say half of them might be male related.
Right.
Why? Because we are seeing more couples now coming in compared to those days. Men do not come in and get their sperm tested, and there's a lot of these male-related factors are environmental factors, which
Mm.
we notice now. Smoking is one good example. Lifestyle. Two,
Okay.
obesity in men is very high. Three,
Okay.
a lot of pollution and an environmental effect on the sperm has taken a toll on men's fertility over the years. So that's
Right.
why it's a very simple test for men to be done, but men has 50% risk of having abnormalities, and some abnormalities in sperm are not reversible. For example, men does not need many sperm to produce pregnancy. Some men have 50 to 20 million sperm. All you need is only one sperm. So that's why male related problem is common. However, they can still, the moment they have sperm, they can still be a father of a child. Unlike
Right.
women, despite having eggs, they can still have to go through a good quality egg, good quality embryo to have a baby. Men only
Mm.
have to contribute one or two sperms. But even said that, there are men with certain abnormalities, like genetic abnormalities, who are born without sperm. And those men
Okay.
cannot father a child because they do
Okay.
not have sperm production. Some men are
Mm.
born with genetic disorders that have abnormalities in the sperm and that they can't produce good sperm for pregnancy. And these are the small group of men who need donor sperm, for example, if
Mm-hmm.
medically allowed to use another person's sperm to father a child.
Okay. So, do you have that service there? Because sperm donation, egg donation.
I mean, in Malaysian guideline, it does allow for certain cultures, religious background to have sperm donation. So yes, in short, yes, sperm donation and egg donation are allowed, and only
Mm-hmm.
for certain accepted culture and religious background. But of course, they
Mm-hmm.
have to go through a very strict process, what we call a program, where they need to be seen by a psychologist, and the psychologists have to deem them emotionally stable to go through the program, and they should be
Right.
medically fit, and a lot of screening for these donors.
Mm.
Yeah.
Yeah. Yeah. I think. Yeah. I personally know someone who has donated sperm. I personally know someone who have donated their eggs as well, and the criteria is totally different. If I'm not mistaken, for egg donors, it will be better if they have a track record, meaning they have born children before. Is that
True.
right?
In a way, it's good to know that that person has donated eggs that resulted in a pregnancy, or the
Mm.
person herself has a child. Therefore, we know that she would have so-called a proven donor. So, in a way, that they are labeled as proven donors. Can you
Okay,
hear
there's
me,
a bit
Tammy?
of lag.
Oh,
Sorry,
okay.
yeah, there was
So,
a bit of
okay, all right.
lag.
Sorry.
Yeah.
All right. Okay.
So could you just repeat a little bit of what you were
So,
saying earlier, please?
no, of course, the donors have someone who has never donated egg before are called someone we do not know their true potential. Wherever, on the other hand, if a donor has donated before, which resulted in a baby, a
Mm-hmm.
pregnancy, or she herself had had a child before, those are what we would deem as a proven donor.
Right.
So a
Okay.
lot of people would like to have a proven donor so that their chances of having a baby is better.
Mm. So when it comes to that level, right? So when you're about 40-year old or 45 years old, and then is there like cases where they would require a younger woman's egg in order to conceive?
Definitely. I mean, most of my patients still wants to try with their own eggs.
Mm-hmm. Mm-hmm.
Normally, in a normal situation, we would try to use their own eggs as much as possible. Using their own eggs.
Mm-hmm.
5% chance for some is, we have to give them the best possible chance. But of course, if they have come to us with multiple failures, having done 4 or 5 IVF outside before seeing
Right.
us, sometimes we should have a very, very frank discussion.
Mm-hmm.
There must be a number that says let's stop here and consider something else. Some
Right.
people would need a closure before they move on
Mm.
to a donor program, and these are the typical multiple IVF failures using their own eggs, or women in their late 40s, 44, 45. When they think their chances is only 2-3% using their own eggs, they would consider someone else's egg. And normally, women who donate eggs are between the age of 21, 22 to 28 years old, with a good
Right.
egg reserve, because these
Mm.
women would have better egg quality and also
Mm-hmm.
better quantity.
Right. Okay. I think we can move on to a couple of questions from the viewers. I'm just going to read out as it is. So the first question is it true that if you are above the age of 35, it is highly likely to be pregnant with twins?
Definitely not.
Okay.
I mean, it's a myth. Twins
Mm-hmm.
happens for two reasons. Naturally, it's about 1 in 66 pregnancy.
Okay.
Naturally, because
Right.
it just happened, one egg might split into two, then you get an identical twin. Sometimes
Mm-hmm.
it's just super fertile, where two eggs comes out at the same cycle, and two separate sperm fertilize two different eggs, and you get a non-identical twin. However,
Right.
because of fertility treatment, the
Mm.
risk of twins goes up. The moment we start giving them fertility medication, you are increasing the number of eggs that comes out each month. And sometimes when
Right.
you do IUI treatment, or you transfer two embryos in an IVF cycle, that's where the risk of twin goes up. So
Mm.
risk of twins goes up in fertility treatment, that's true. But just by age alone, it's not true that women tends to have twins just because they are older. Actually, it's the other way around. The risk of pregnancy is lower because they are older.
Right, right, right. Okay. And when it comes to, we spoke about how to reduce pregnancy risks. Is there a way to reduce birth defects in a child?
Birth defects in a fetus
Yeah.
normally happens for two reasons, main
Mm.
reasons. Either they are born genetically abnormal, which we can detect.
Mm-hmm.
For example, a
Yeah.
child with Down syndrome may have a lot of birth defects, and
Mm-hmm.
two, just developmental defects that can occur for no reason. It's just pure bad luck. When the baby is forming in the uterus, they can undergo a defect. For example, common defects are, yeah, spine disorders, heart problems, hole in the heart, skeletal disorders, the leg abnormalities in the spine, arms, legs, or gut. Another one of the avoidable risk of abnormalities are folic acid. That is
Mm.
why women who are planning to fall pregnant, or planning pregnancy, should be on folic acid 3 months even before they fall pregnant, and then the first 3 months of pregnancy is very important. Helps to reduce the risk of Folic acid supplementation helps to reduce risk of abnormalities in the spine and the brain of the baby. So these are
Okay.
avoidable, but some are not avoidable but should be detectable. That's why we do a series of ultrasound during early and the mid pregnancy to detect any of these abnormalities sooner than later.
Right. But then again, let me just clarify. So the screening can only be done for genetic abnormalities, right?
Plus structural for defects.
Oh,
So
okay.
yes,
We can do
the
that as
defects
well.
requires an ultrasound scan. Genetic
Mm,
needs a blood test. So that's why in pregnancy
okay.
they must be combined with two things: a genetic
Mm,
blood test, which is a genetic test, which comprises a blood test for the mother, and an
mhm.
ultrasound scan to detect abnormalities in terms of developmental.
Okay.
Ultrasound scan can detect any birth defects. So we need to
Mm,
combine both. Just
okay.
by doing one, you can miss another one.
Mm. And can we do anything while the baby is still inside? Like
Certain
there are many.
treatment that, yeah.
Mhm.
Certain abnormalities in developmental abnormalities or structural abnormalities in fetus can be treated while the baby is inside. And these are all in utero treatment done by
Mhm.
highly specialized specialists, not people like me, but they are called fetal specialists. There are a lot
Right.
of good fetal specialists in Malaysia that we
Mhm.
normally would refer to them. And there are a lot of treatments now available to treat the baby and prolong the pregnancy while the baby is still in the mother's womb.
Okay. Okay. And another question would be, what are the risks of IVF for women above 35, especially if they have past history of ectopic pregnancies or miscarriages or failed IUI?
I mean, just by hearing that, I feel like that person has a lot of good things. Let's not look at the negative things. She has not have a baby yet to take home, but she had a miscarriage. That says that she could get pregnant. She had an
Okay.
ectopic pregnancy, just pure bad luck. It stuck in the tube that she probably. She still have a need to fall pregnant. Therefore, age is also nice, 35 years old. Anyone below the age of 41, 42, I always feel that they are good age to get a pregnancy. Therefore, I think looking at the positive things, she's young, she had a proven pregnancy. Unfortunately, they have no baby yet. But I think these
Mm,
are the couple or these are the women who have a good chance of having an IVF pregnancy.
right.
A good
Okay.
prognosis, I would say. Probably about 40 to 45%, looking at age
Mm-hmm.
alone.
Okay. I like how you re redefine the whole thing, because it was just a list of horrible things happening one after another, but it's actually a good news because there's actually possibility for them to get
Exactly.
pregnant.
Exactly. That's why it's very important in fertility point of view. You don't look at the things that you can't see. You have to look at you have to be very sensible and
Mm-hmm.
very orientated to pregnancy.
Okay.
That's why sometimes they lose a lot of time. That's the other thing, Tammy, I forgot to tell you. A lot of people
Mhm.
lose time by doing unnecessary investigation.
Oh, okay. How so? Like what kind of investigation?
Test and then they try something different, so they go on a very long winded investigation, but they lost time because time is of essence in fertility. But
Right.
you could see by the time you see a fertility doctor, within the first visit you should have made a plan. Most people do not have a plan. You can't see
Okay.
10 doctors and 10 different plans. It's like building a house with 10 different architects. You can't. You must have
Right.
one plan and build with the builder you want. Similarly, you have to have a plan, not to let 10 different doctors give you 10 different plans.
Right.
That's why it's so important to have one plan and execute it within the stipulated time that you have. Some
Okay.
couples have a long window, a large window, so they could take their slow steps. Some windows are very narrowed. Very rarely we see a closed window. Then we have to talk about other options like adoption, egg
Mm.
donation, sperm donation. You see,
Right.
that's very important to zoom in straight to pregnancy and the problem of fertility problems.
Okay. So wait. So sorry. What do you mean by plan? Okay. I'm gonna have 3 kids in the next 10 years. Is that what you mean?
It's a very long, very far ahead plan. Having the first child is the most important plan. So I
Right.
would normally tell them, if you're 41 years old,
Mm.
your pregnancy, you should look at it. The next 3 to 6 months is very crucial for me.
Okay.
If I look at it 1 year, I think it's a bit too late. If I'm
Mm.
30, if I'm 30 years old and I want a pregnancy, I would look at it like maybe 1 year. Let's do something simple, provided there's no big issues. Let's take a small step.
Mm.
emotionally for both of us. As a doctor, I also feel like if a patient gets pregnant naturally, my job is done. But the moment they
Right.
go through IVF, as stressful as it is for them, it's also stressful for the doctor because they put a lot of hope, money,
Mm.
emotion in it, and it does take a toll on us as well. So that's
Right.
why we have to have. That's why for me, it's fertility plan is very important. The moment you see a doctor, you must tell the doctor, let's take this step for 3 months. And I always
Okay.
tell them, don't cry each month for the next 3 months if you have your period. Because of different planning.
Mm.
So that plan is very, very important because if you don't have that plan, you will go year by year by year, and then you realize I lost a good golden opportunity where my pregnancy rates were much better when I was in my 30s, not in my early 40s. So that's
Right.
where I would say every couple must have a fertility planned out for them
Mm.
based on screening. Don't
Okay.
have a plan without screening. What if the husband doesn't have sperm? Whatever you do, you'll never get pregnant. Or if the
Right.
woman is a blocked tube, whatever you
Mm-hmm.
do, you can't get a pregnancy. So have a
Right. Right.
simple screening and then a plan.
Okay. So I think, would you suggest that nowadays, especially considering how people are getting married late these days, would you suggest that that is something that is, by default, a compulsory thing to do if you're planning to start a family soon?
I would, if my children, once they're grown up to that age, I would say, let's get a simple test done. It's a simple ultrasound scan, a
Mm.
tummy scan, a simple blood test, but it tells
Right.
out. It's not like health training every year or every 2 years you have to go and do your glucose. No, you just do
Yep.
one scan. And trust me, you may pick up surprises sometimes. We have a lot of patient comes in just for screening because they just got married and planning to delay their childbearing or thinking
Right.
of trying some contraception now. But
Mm.
when they come for screening, they get surprises.
Okay.
And the whole plan for them changes and they start
Oh,
planning to have a
okay.
baby sooner than later. So that's why I say a simple scan, a blood test would give you a lot of information, and they are
Mm.
not repeated blood tests or scan that you have to go and see them on a yearly or 2 yearly basis. I strongly
Okay.
recommend them to do.
Right. Right. Okay. And I think, speaking of, trying to get married, and you want to see, thinking about the future, starting families, most of the time when it comes to women, we always have, I think, the moment women reach 25, 28, there's already talks about biological clocks, and you need to start getting, you need to start settle down soon, you only have a few more years left and things like that. But we know that these days delayed pregnancies are inevitable. So how can we destigmatize, how can we make late pregnancies a little less scary?
No, in my opinion, I think first of all we should not compete with another person for pregnancy. That's where the social media plays a very negative role.
Mm.
Women tends to compare, especially when friends get, when one person gets married and have a pregnancy, the other person been married for a long time, and they
Mm.
go into emotional breakdown or emotional isolation because another friend got married. You can't compete with another person who gets pregnant earlier or who get pregnancy easier, because
Right.
pregnancy is a very private thing, and you can't compare two-person because they have different partners. You're totally different physiology. Even twins can't compare themselves because two different
Mm.
partners unless they say they share the same partner. So even I always tell them even twins can't compare. What for who gets pregnant earlier than later? It's a
Right.
competition between the couple has to have a plan. If we were to have a child, how many children should we have? That should
Mm-hmm.
be started earlier. The sooner, the easier. The sooner, the
Right.
better. The sooner, then you have a clear plan what
Mm-hmm.
you're going to do and what you're not going to do.
Mm.
So my advice to all these women: do not feel that you need to start your family the moment you get married or the moment you start having a plan to have a baby. But empower yourself with one important information: find out your true fertility potential.
Mm.
A true fertility potential for a woman would be their egg reserve. Statistically speaking, the younger they are, the better the reserve. But in the real life, some younger women might be less fertile than older women because
Mm.
each women are born with certain set number of eggs, and it goes down by year by year. So it's good to know your number sooner than later. If you're starting at a lower number, or you might want to freeze some eggs sooner than later, or probably want to start creating embryos and banking them up for future. Doesn't mean you have to get a baby now, but you can create
Right.
embryos, bank them up for later in future, so that even as time goes on, you can still have a child of your own by these frozen embryos or frozen eggs. But
Okay.
the most important, find out your true egg reserve or true fertility potential, and don't let
Okay.
age becomes a factor that you gives you a lot of emotional um, you know pressure to perform or to show or to exhibit to others, because that's very very negative way of living, and it will affect many women are affected by that. So some of them are actually certain some of them are actually having anxiety disorder and depression because of this.
Right.
And I feel like all these are avoidable if they have clearly made a decision. I just want to go and screen myself. At least I know, and I know what to do.
Mm.
Don't need a male partner for to do all this. So
Right.
I
So would you suggest this type of screening to be done for single women as well?
oh definitely a single woman. For a good example is when you do this egg reserve testing. It doesn't only tells them give them the information about their egg reserve. It also tells them if do I have some hormonal imbalance, because
Mm.
sometimes this egg reserve are affected because they have some underlying gynecological disorder,
Right.
and that will point to the gynecology to see, hey, how come a young woman having a low reserve, are they having some form of gynecological disorder? So not only to know about your fertility but also about your gynecological health.
Right. Okay. Right. I think I've asked all the question I wanted to ask, and I think I've also asked the questions that the viewers have been asking for the last couple of days. I think that's it. Yeah, with that, I really thank you so much, Doctor, for spending the time with me this evening.
Oh, my pleasure,
I get
Tammy.
Yeah, I feel like there was a lot of things that I was not aware of or probably ignorant of. And I think one big takeaway from this would be how important screening is, fertility screening is. I don't think many people are talking about it because we do a lot of medical screening, health screening every 2 years, but we don't talk about this as often when it comes to fertility screening. And I don't think even people who are planning to start a family do that,
True.
right?
Yes.
Yeah.
Unfortunately, yes.
Yeah. So thank you so much for this. I
My pleasure.
really
Thanks for
hope,
having me.
yeah, I hope everyone who is watching have gained some useful insights as well. Thank you so much, Doctor.
Thank you. Good night.
Have a good night.
You too. Bye.
Okay. So thank you so much, guys, for tuning in. So if you want to watch tonight's episode and all the rest of the episodes from the season, it is on Bikina Resources YouTube channel and also Spotify. Thank you. Good night and have a good weekend.